Good morning and welcome back to our normal Spotlight time period. Today on Spotlight, an in-depth look at COVID-19 and the impact it is having on people of color in Michigan and America. Why are the coronavirus statistics so out of line with their population numbers? We'll ask three leaders: Pontiac Mayor Dr. Deirdre Waterman, Detroit Area State Representative Tyrone Carter, a COVID-19 survivor, and Dr. Kimberly Dawn Wisdom, Senior Vice President and Chief Wellness and Diversity Officer at the Henry Ford Health System and the former Michigan Surgeon General. And later on our program, we'll talk to Ivana Kalafatic of Detroit Is It and how she is trying to help small businesses connect and navigate through the COVID crisis. It's Sunday, April the 19th. I'm Chuck Stokes, and this is Spotlight. Dr. Wisdom, thank you so much for joining us on Spotlight today. Hope you're doing well.
I am, Chuck. Thank you, and you as well.
I am. I know you've been super busy. You're at Henry Ford Health System. You used to be the Surgeon General for this state, but Henry Ford right now is, you could say, it's the epicenter for what's happening here in Detroit and to a large extent what's happening in the state of Michigan. Your thoughts as a medical professional on why this has hit Detroit and why it is hitting the African American community so hard?
Yes, well, it's hitting Detroit, southeast Michigan, particularly hard, and Detroit is identified as a hot spot. And it's in part because we have many vulnerable populations, many populations of color, and we know that populations of color experience health disparities or oftentimes poor health outcomes, and due to diabetes, hypertension, heart disease. So when a pandemic, a virus like COVID-19 presents itself, it has a disproportionately more significant and more deleterious impact on communities that are already vulnerable, already compromised in some way because of underlying clinic and health conditions.
So this is not something new, but is it that we were caught so totally off guard because the structure of our medical system is, for lack of better words, maybe so out of whack and not ready for these type of epidemics?
Right. Well, Chuck, in part, you're absolutely right. These health disparities have existed for decades, and Henry Ford Health System has really taken a leadership role in the region and the nation in terms of addressing health and healthcare disparities, or those gaps or those differences in care, and has really taken a role in looking to achieve health and healthcare equity. So there are systems in place. Of course, in any setting, they could be more robust because the disparities are profound, they're persistent, and they're not going to be mitigated with programmatic efforts here and there. There really needs to be a very systematic approach if we're truly going to eliminate these health disparities. And Henry Ford has taken a leadership role, and we have many programs, many practices, and many policies that we're working with, even at the state level, to ensure that communities of color, in particular, all communities, but specifically communities of color, are protected during challenging times and during times when we don't have a particular challenge or a pandemic occurring.
Dr. Wisdom, do you think this nation would have been better prepared or could have reacted quicker if more states had Surgeon Generals? You were the very first some years ago. I understand that you've been consulting with Surgeon Generals, I think, in maybe Arkansas and California, have been mentoring them to some extent. But there are a lot of states that don't have that person to be able to work with the U.S. Surgeon General.
Correct. Chuck, about 16 years ago when Governor Granholm appointed me virtually, I had the honor to serve as the first state-level Surgeon General in the nation. And since then, Arkansas, Florida, and most recently a year ago, California appointed Dr. Nadine Burke-Harris to serve in that post. And while I've done a lot of writing around regarding the Post blogging and the Huffington Post blog, have issued briefs from the National Academy of State Health Policy around this kind of leadership role that could play a significant role, particularly when there's a crisis or a pandemic. I harken back even to SARS that occurred in 2003. And the Surgeon General role was very focused on communicating about SARS, allaying the concerns of the public, being that trusted voice, and having a post like that in other states that could actually work in a very coordinated fashion with the U.S. Surgeon General could actually create the ability to communicate very systematically, very consistently to the community at large in terms of how to prevent the spread, how to protect yourself, how to engage in health and wellness behaviors. So I'm pretty passionate about that role. I think it has great value.
Looking forward, because there will be some type of crisis down the line. We don't know when and what, but we know that there will be something. What is your hope for the structure of our medical system that we will have learned from this to be better prepared?
So I think having stronger relationships and stronger partnerships in terms of the public and private sector so that they can respond. Now, mind you, there are many preparedness efforts that occur each and every day at the state level and at the systems level to prepare for a crisis. However, COVID-19, the novel virus, has been much more significant than anyone could have anticipated. So naturally, it has stressed our health systems and our government entities to respond. But I think going forward, we've learned a lot and we'll continue to learn a lot so that we can be much more nimble and much more responsive. So California and New York are two states that have been particularly responsive more quickly, and largely it's because they had experienced disasters, such as 9/11. So when you experience some of these disasters, you are much more prepared when you're faced with it again. So I think having those collaborative efforts strengthened over time so that we can certainly do everything we can to protect the people in states and people in communities at large.
Dr. Wisdom, thank you so much for joining us today on Spotlight. Thank you for your patience. A lot of what happens, people at home can't see, but it took a little while to be able to get your signal and everything in, and we just appreciate you taking the time and working with us. And best of luck to you personally, as well as to the role that you play there at Henry Ford Health System.
Thank you, Jack, and the same to you.
Thank you. And when we come back, we'll be joined by the mayor of Pontiac, and we'll also talk to a Detroit area state representative, get their opinions on COVID-19 and the impact it is having. We'll be right back.
One of the things that's disturbing about the COVID-19 virus is that 4 out of 5 people who get infected are infected by someone who does not have symptoms. People who study virus spread assign them what are called basic reproductive numbers. COVID has a value of about 4, which means that for every person who's infected, on average, up to 4 people might become infected by the person who's transmitting the virus. That means the number of people infected could possibly double every 6 days. And if you do the math, that would mean that a single person after 60 days could be responsible for 1 million infections. So this is serious. So the goal is to eliminate the vectors, and that means that we have to protect ourselves, and by doing that, we protect everybody else. So don't be the vector.
Let me begin with you, Mayor Waterman. You're a graduate of Meharry Medical College, established way back in, I believe, 1876, a proud graduate there. The president and CEO recently put out a video and a statement asking particularly African Americans to not be the vector, that this disease is indeed deadly. Your thoughts about what he has done, and is it your hope that the African American community in particular really listens to this?
Yes, and I'm so proud to be a graduate of Meharry Medical Colleges, and it's very right that the president and CEO did put out that message. It's important for us to put as much messaging out as we can to educate and to inform people about how deadly this particular virus is. It is unusual, it's mysterious in its ways of operating, it's still being studied, and we're still gathering a lot of data about it. And so we're putting out with every media, everybody who can, to inform people because this is such an unusual situation.
Representative Carter, you have firsthand experience. First and foremost, how are you doing? You contracted this virus, and last I heard, you're doing pretty good now, correct?
I'm doing well, Chuck. I got my results. I went and retested the other day for peace of mind for my family, for my colleagues, and everybody who comes in contact with me. The test came back negative.
Good. We're absolutely glad about that.
Absolutely.
There was a major protest in Lansing where you spend a large portion of your time. People expressing their First Amendment rights and urging the governor to stop what many of them called this draconian measure of having people stay at home and businesses closed down. Your reaction, both as a survivor of this, but also as a state representative?
Well, everyone has their First Amendment rights to protest, but do it in a manner that is consistent with the executive orders. You know, there was no social distancing. All it did to me was show how selfish people are, because people want what they want. And I think it was really appropriate because I've gotten phone calls for people who say they can't take their boats out, for people in my district who say that they can't plant right now. And what I try to tell them is District 6 is in the epicenter. We're here. I mean, we are a hotspot, and we have people literally fighting for their lives. So what this has demonstrated is the selfishness of some other people. Because it's not directly impacting me, then I shouldn't have to abide by those rules. And we get it all the time in Lansing because people are position driven. Their position is their position. They want what they want. So if they feel that way about some of the governor's rules, then my response to them is, well, don't take any of the money that comes with this.
Mayor Waterman, you have taken steps in Pontiac to try to deal with this virus. Can you update us on what specifically you've done over the last few days here?
Yes, most recently, this week, we opened the first testing site for coronavirus right here in Pontiac. We did that in collaboration with Oakland County. Dave Coulter is our executive here. And now we're testing up to 250 people a day. This was much needed in Pontiac because there had been so little testing going on among Pontiac citizens and Oakland County for that matter. And so this test site is much and long awaited, much well received. And the number to call that is for the online nurse call. And we want to publicize that because it's so important to get the data. As you know, most of the hospitals here and the first responders have been so heroic in the way they have been saving lives and treating people. But the testing has been so scarce across the nation. This is no secret. And so they've only been able to test people who were symptomatic enough to need hospitalization. That meant there were a lot of people walking around the general population who had symptoms or who didn't have symptoms and didn't know whether they were contagious or not. And that's one of the things that's very frightening to people, not to know if they're carriers or if they're walking next to somebody who can be a carrier. And so that's why it was so important for people to exercise social distancing in order to protect ourselves.
Why do you believe this has hit the African American community and community of colors so hard, and one would say disproportionately compared to the population rate that we have in this state and in this country?
Well, what it has demonstrated to me, it's just put a magnifying glass on all the disparities that we've had, that we've known about, that we've talked about for generations in the African American community. When we talk about access to health care, when you talk about that your zip code can determine your life expectancy. I have two of the documented most polluted zip codes in the state of Michigan, which may remove 5 to 10 years from your life and you not know it, but because of years of segregation, you not being able to move places, you moved where you were comfortable. And unbeknownst to you, that it was, the environment, the air quality was horrible, that impacts your health. The other thing is just the disparity when it comes to care. I have friends Myself, I've got a decent job with healthcare, but still some people may have a job with no healthcare. They may have a job with healthcare where they have deductibles. So it becomes more of a survival issue for a lot of people, and they put their health to the side when they're thinking about survival.
All right, I need to take a real quick break. Don't go away. Stay right where you are. We'll come right back with some more questions right after this. Pontiac Mayor Waterman, you are also involved with the National Medical Association. Their concern over this is specifically what?
The concern is that now that we're starting to have data, I mean real data, although we need to do a lot more data collection, and that's what these test sites are about, is that we're finding that there's a staggering disproportion of African Americans who are affected by the morbidity of this disease or are suffering more serious complications. And this is in numbers which are staggering when you think about it. 45% disproportion in terms of the number of African Americans who are dying from this disease. In some areas, it's as high as 80%. So that is important for not only the National Medical Association, but also the African American Mayors Association, of which I am a member, which has now sent a protest to both the Surgeon General as well as to Dr. Redfield of the CDC, saying we need to collect this information. Data is important. It's one of the guideposts of the treatment and the spread of this disease. And we need to do more of that with demographics, as we've done for every other disease entity and every other kind of study that we've done. It needs to be done for coronavirus as well.
Representative Carter, it's oftentimes difficult in this country and in this state to separate politics from policy. When you go back to Lansing, everything gets back in session and you're all there as a group together. What is it, having gone through the experience that you've gone through and with the concerns that you have, what is it you'll say to your colleagues to try to move forward in terms of policies?
All I can do is what I can do is represent the people of this district. And we have been disproportionately affected. So when I go back, not only as a survivor, but as an advocate, we can talk about those things. We've had reforms this year in this session when we talk about criminal justice reform that has severely impacted the African American community. We've also talked about car insurance, where, of course, we pay the most here in Metro Detroit. So there's been some movement. This now healthcare is the next big thing that we have to work on and work for, because it comes down to access and advocates. Well, I'm going to be an advocate, and they're just going to have to keep telling me no until I get a yes, that we get some funding for what we need to prevent this from happening again.
Mayor Waterman, we apologize for some of the audio glitches that we have in there. This is a whole new world kind of for all of us in terms of how we're doing television these days. But the main thing is that we're all staying safe. And when Spotlight returns, we'll sit down with Ivana Kalafatic of Detroit Is It. We'll be right back. You're the founder of Detroit Is It, but you've created a new online service to help small businesses. Tell us about that and why this was sort of sparked out of all this virus.
Sure. So first of all, Chuck, thanks so much for having me on and having our vision and our opportunity on. So the basic premise for Detroit Is It is to really be a media platform for telling the stories of all of Detroit. And clearly, there's such a challenging time now that all of the small businesses, ourselves included, restaurants, you name it, yoga studios, anything brick and mortar is really having a very hard time managing their business and their finances and the economics of this time during the crisis. So our teams between Detroit Is It and Together put together a digital media hub, which is called the Detroit Help Hub. We launched about 2 weeks ago, and we really just thought that it might be a very interesting opportunity for there to be one collective space online for businesses to sign up through, where they can have up to 15 different ways to figure out and to sign up for funding. So that could be anything from a GoFundMe.
So Ivana, it's really like one-stop shopping online,
Right.
Particularly, and it's concentrated on Detroit, and trying to bring people together, but also keep them together, and to try to give some real help to small businesses. Many of them are just absolutely struggling right now. Some will make it, some won't make it out of this, unfortunately.
You know, they're being extremely clever, but there's only so much that you can do within this time. So this resource is something that can really help digitize the experience for people too.
Yeah, what's been your feedback so far from both the businesses as well as people who are going online to be able to partake from these various services?
Sure. So what we consider to be users, so anybody like you and I, for example, that would go online looking for a restaurant that's open or looking to shop online for a small retailer that has e-com, the response has been really, really good. In one hand, there is the challenge that folks are definitely having a hard time financing things that are outside of their immediate needs. And I think we can see that. A lot of, obviously, the businesses can see that. But the response to this platform from both the city side, from civic partnerships that we have, from brand partnerships that we work with, but ultimately from users, has been really great.
Coming out of this, what do you think will be the lesson learned, and what is it we need to do to get that momentum back?
Yeah, I think, critical $10 million question we're all asking ourselves. My takeaway would be connectivity and community. I think the more connected and the more work that we do together, and we're seeing that all across the board, from nonprofits that are supporting both businesses and individuals to the way that there's fundraisers that are going on that are virtual. I think that's one takeaway that we really need to think through. How helping one another together and being connected is really going to help the city. And I really think the other takeaway from all of this is there's going to be a new change of pace in the way business is done. We're also hoping with the hub that we can actually have the opportunity for small businesses to have websites through this service as well for free. That's what we're actually offering to small businesses, to help digitize their business for the future online.
Ivana Kalafatic, thank you so much for joining us. Give us the website one more time so that people can make sure they access it on their computers.
DetroitHelpHub.com.
Excellent. All right. Have a great day. Thanks for joining us today on Spotlight, and we'll definitely stay in touch with you.
Thanks, Chuck.
All right. Stay safe.
Bye-bye.
I'm Chuck Stokes. We'll be back next week with more newsmakers in the Spotlight. And please remember to stay safe. And don't forget, you can always watch Spotlight online at WXYZ.com. Have a good day.